I think one of the things that we do an awful lot from an agency side, quite rightly, is talk up the real, very real benefits that there are for your brands and your companies in doing social media. But we downplay quite significantly the internal challenges that you've got in aligning your organisations to do it. And if I'm honest, we downplay some of the risks associated with it. And in the face of the ambiguity around regulation, in the face of trying to align organisations to get to grips with social media, I think we're starting to see some really great case studies of how pharma can make this work. What I think is excellent about this is that sort of social completeness of it. You know, it has at its heart a very strong disease awareness side, but it's surrounded by sort of a social ecosystem that allows users to get to content of that site in the platform that they're most happy with. And the fact that they've got that sort of social ecosystem surrounding it, it allows users and sufferers to share that content and that information very easily and very quickly. I've worked in the area of eczema, which is obviously very similar to psoriasis. And the problem that eczema sufferers have and psoriasis sufferers have is that they struggle to understand how severe their condition is, and they struggle to understand how much the condition impacts on their lives, so they massively undertreat themselves. And what's great about this site is that it provides users with some very simple utilities and tools that allow them to measure the impact that the condition has on them, both from a severity sense and also an emotional sense. And then it then provides them with simple information about what they should do about that issue. So it's a traditional disease awareness side, really, but adding real value. I don't want to miss out the fact that their Facebook conversations are great, and that a lot of the conversations that happen in that space, you can see, are these sort of supportive conversations. There was a number of what they called advertising messages on the site, and these were largely by companies that had completely unevidence-based products. You know, these organisations would post up sort of fake user experiences. I've tried this and my eczema was cured within 3 days. Users of the sites actually self-monitor very actively, and anything that appeared that had that nature to it was quickly attacked, and it was very quickly removed from it. But the sense that there's this self-policing of these communities, I think, is very interesting. I wanted to share with you some work that we've been doing for Philips. Not immediately you think of as a healthcare company, but actually they are massive suppliers of big hospital capital equipment. And they've asked us to change people's perceptions of Philips, so it's not just about televisions, it's about health and well-being as well. And their target audience are leading clinicians and purchasers within hospital settings. And what we've done for them is to create a destination site, a stunning destination site. Actually, the screen grab doesn't really do it justice. But what we've created is a portal that we recognise had to have a point of difference. Now, there's no way we're going to compete with things like BMJ or Doctors.net for their breadth of content. But what Philips are famous for is innovation, and innovation in technology. So the Get Inside Health portal has a position where it's sort of Wired meets the BMJ. You know, really sexy stuff around technology in healthcare. We've partnered with a number of really strong media partners, media content providers, you know, including The Economist, CNN, you know, Time. This portal's got incredibly good content on it, really engaging content. So much so that I think it's only been running for about a year. We've got had over 1 million views, unique views, and 30,000 registered healthcare professionals viewing the site, receiving our emails, an opening rate of around 30%. You know, it's fantastic stuff. And the spin-off from that has been that because of that content so good, because people believe that Philips are really involved at the cutting edge of innovation in their specific disease areas, we've been able to spin off into some LinkedIn groups. And we've created a number of LinkedIn groups, and they have very vibrant conversations. And I think there's around 20,000 members within those LinkedIn groups, and Philips are playing a very active role in the management and the facilitation of that discussion. So maybe there's some parallels, I think, with how pharma can start having some more direct conversations with its healthcare professionals. So, my final thought really, we know that anything we do, however excellent it is, it's going to be a little bit imperfect. However, that shouldn't let us do it, because there are areas where we can add real value to both patients and doctors alike. And those tools and utilities that we provide, those supportive content that we can have on our message boards, I think that's where we should focus on. I think we should focus on what we can do, not what we can't do.